You ever tweak something a little bit and then spend the next month playing that game of, did I just mess something up? Do I need to stop lifting? Or am I making things worse? Then you either shut things down and stop lifting completely, or you push through it, ignore it, and flare things up worse. Today, I'm going to teach you the traffic light system. It's the exact framework I use with my clients to help them train confidently without freaking out every time something aches. Because pain doesn't automatically mean damage or new injury. And learning to differentiate the two is the difference between stalling for 6 months and being back to training in 6 weeks. So here's the big idea. Pain is not always a damage detector. It's more like an alarm system. And sometimes that alarm can get a little overprotective. It's like a smoke detector that goes off when you're making toast. Nothing's on fire, but it's loud and it's convincing. Your nervous system can do the same thing, especially if you've had a recent injury, a flare-up, been really stressed out, or you just haven't slept well. So instead of just asking, does this hurt? It should be more, is this harmful? And that's a very different question. This traffic light system helps you to stay active, avoid overreacting, avoid underreacting, and gradually build back capacity while staying away from that negative fear-based boom or bust cycle. This framework is how we move from fragile to resilient. And once you master this, you might not be pain-free forever. That's impossible. But you will be free from pain, allowing you to break past that trap and know exactly what to do and how to handle it when pain and when flare-ups come. Let's start with the red light. That can be the most obvious. A red light starts with a harm check failure. That means you'll see major loss in strength, range of motion, or just overall function. I'm talking you suddenly can't bend your knee more than halfway, you can't bear weight on that leg, or you can't raise your arm above your head when you could yesterday. Major changes to your overall function. And that could look like that pain starting during activity and then lingering for days or even weeks afterwards. Or it could be you feel fine during activity, but then the next morning, that pain and the symptoms spiked. And that's not normal rehab discomfort. That needs a little bit more attention. So the action plan there, stop the activity, notify your clinician if you're working with one. That way you can take a step back and figure out what's going on. Now, a red light is rare in well-managed rehab, but it does happen. And even if it does happen, it still serves as information, as a data point, to give us an idea of obviously what we did was too much, or your body just wasn't ready for it. Now we'll jump ahead to the green light. Most people get the green light wrong. A green light does not mean zero pain the entire time, although yes, that is a green light. So first we got to do our harm check, and this time we passed. We had no loss in strength, no loss in range of motion, and no loss in function. But what's key here is you can have a little bit of pain during a session and still be a green light. What's key is that immediately after the session, you return back down to baseline, feeling good as if nothing happened. Now the timeline for that return to baseline can be a little bit different depending on where you are in your rehab and how long that pain's been going on. So if you have a newer injury like a hamstring strain or an ankle sprain, that window is pretty small. So within 30 minutes after that activity, you should have returned back to baseline. If you did, that's a green light. Now stretching out that time window, if you've been dealing with this for about 8 to 16 weeks, so between 2 and 4 months, you have about 2 hours for that baseline to return for you to be in that green light territory. But now this is where it gets weird. Most of the people that I work with have been in pain for a long time, typically several months, years, and you have a little bit different rules. As long as you return to baseline within 24 hours, this is a green light. It means your body's actually adapting to the demands we put on it pretty well. I'll give you an example. Let's say you've been dealing with chronic knee pain for years, and you're going through a rehab session, and during your workouts, you felt some pain on the front of the knee, say about a 3 out of 10. You felt it, it was a little irritating. After the session, you have some soreness, you're definitely feeling it. It's up, it's a little bit angry at you. But by the time you shower, go to bed, and wake up the next morning, that pain is right back to baseline. That's actually a really good sign that your body adapted to the load that we put on it and recovered well. And that's exactly how capacity is built. So overall, no matter where you are in that time window, green light means you're good to go. Stay the course, you're doing the right things, just stay patient and let your body adapt. Now I save the yellow for last because this is where the magic happens. And it's honestly where most people panic. So as always, let's do a quick harm check. No loss in strength, no loss in range of motion, no big losses in function. So symptoms may have increased during your activity, and they may have lingered a little bit longer than we might expect for a green light. Maybe your shoulder is still pretty cranky that evening, or you woke up with some more knee pain than you would have liked that next morning. But it still does settle back to baseline Again, maybe just a little bit longer than we would have liked. Looking at those windows of time again, hours for the early stage, 24 hours for that mid stage, and 48 hours later for that late stage or chronic. Now, a yellow light most likely does not mean a new injury, but what it does mean is that we're approaching your limit. You might be doing just a little bit too much, or may have added just a little bit too much too soon, but overall, your body is actually still responding pretty well. Think about it in terms of lifting, like you're in the gym, and you just go and rep out 225 5 times. It's super easy for you. There's no real challenge. But if you go and try to bench 365 with no preparation and you tear a pec, that's obviously a red light, and we don't want that. But when we find that challenging sweet spot, 275 for 5, 285 for 5, whatever that looks like for you, that's where that growth happens. You maybe wake up the next morning with a little bit of soreness. That's that yellow light, and that is stimulus. The mistake that most people make is when they hit a yellow light, they look at it like a red. They shut everything down for 2 weeks, then their body gets weaker, and they start the whole cycle over again. Yellow is not failure, and it does not mean that you need to go radically off course. But it does mean that you need to be patient and pay attention. Don't do anything new. Don't add any new exercises. Don't increase the load anywhere. Just coast where you're at. Let your body catch up. But when you can reframe these feelings from, oh no, I'm about to injure myself, to, okay, my body's taking a little bit longer to adapt than I would like, but that means I'm challenging myself in the right way. That is key, because that mental shift allows your whole body to be in alignment with what you're trying to do, which is get stronger and build capacity. So trust in that, and it will adapt. So the entire goal of rehab is this: no more boom and bust cycles. No more, I feel good, so I'm gonna go 110%, and then, oops, I went too far, and now I have to take a break for a month. We want consistency. The green light builds capacity. That yellow light pushes that limit and pushes the capacity a little bit. And the red light is there to protect you. The long term is learning to be really comfortable in the yellow and the green, because that's where resilient athletes are built. Not from avoiding the pain, but understanding it. And knowing that even if a red does come, that's feedback, that's information. You can adapt and learn and approach it differently next time. If this video helped you, please like, comment, and subscribe. And if you have a friend that spirals every time they get a new random ache or pain, send this their way. And if you want to see how this applies, maybe in the bigger picture, looking at some activity modification and how we actually may adjust your programming, I made a recent video last week called How to Rehab Any Lift, Even Squat, Bench, Deadlifts, and Olympic Lifts. Check it out. I think you'll like it.